സെഷനാണ് നമ്മൾ കടക്കാൻ പോകുന്നത്. We will take you back to the pharmacology class. Calicut Medical College 76, 77, 78 പീരീഡിൽ നിങ്ങൾ ഫാർമക്കോളജി ക്ലാസ്സിലിരിക്കുന്ന ഫീൽഡിലിരിക്കണം. എന്നാലേ ഇത് മുഴുവൻ അത് എൻജോയ് ചെയ്യാൻ പറ്റും. ഓക്കെ.
Good morning, sir.
Good morning.
Your attendance, please. Abdul Hamid. Abdul Rahman. Ajay Kumar.
Yes, sir.
Chandrika Devi. Dominic Putur. Feroz. Geeta.
Present, madam.
Gobinathan. Jalaja. Jairaj. Jairam.
Yes, sir.
Jaisri. Josarappa. Jose UK.
Yes, sir.
Kamarudin.
Yes.
Kamarudin A. Kochu. Kunyamat. Kuryakos. Lee.
Absent.
Mini John.
Present, sir.
Mohan Mohammed.
Yes, sir.
Mohan EP. Mohan PK. Mohan Das. Mohan Kumar. Musa Kuni. Mohan Bashir.
Yes.
Murali PK. Narayanan BK. Narayanan. Naufal. Pomana. Peter. Purushothaman. Raghavan. Rajashekaran. Rajendra Babu. Ramashnan. Ramashnan is absent. Ranga. Rani. Devendran. Seidali Kuti. Shashidharan MP. Shashidharan PK. Shashidharan PS. Shashidharan VP. Suhasini. Sharifa. Soman. Sulaiman. Tahira Tilagan. Udaybanu. Vaidyanathan. Vanaja. Vanaja is here. Vasanta. Venugopalan BC.
Yes.
Vishwanathan. Yes. Sainam. Thank you. Professor will come now.
ഫാർമക്കോളജി പ്രൊഫസറാണ് വരുന്നത്. നിങ്ങൾ എല്ലാവരും പഴയ പോലെ ഭയങ്കര സ്ട്രിക്റ്റ് ഡിസിപ്ലിൻ കീപ്പ് ചെയ്യണം. ഇന്ന് എനിക്ക് തോന്നുന്നു സാറ് പറയാൻ പോകുന്നൊരു കോൺസ്റ്റിപ്പേഷനും കോൺസ്റ്റിപ്പേഷനും നിങ്ങൾക്ക് എല്ലാവർക്കുള്ള കോൺസ്റ്റിപ്പേഷനെ പറ്റിയാണ് സാറ് സംസാരിക്കാൻ പോകുന്നത്. സാറ് വരും. സൈലൻസ് പ്ലീസ്. സാർ എനിക്ക്
Good morning, sir.
സാറിനെന്തൊരു കോൺസ്റ്റിപ്പേഷൻ.
My dear students, today we will discuss certain important pharmacological topics which are highly essential for your examination. The topics are actually sympathomimetic drugs acting on the myocardium, sympathetic and parasympathetic drugs acting on the myocardium. Of course, the acetylcholine. The acetylcholine has got both nicotinic and muscarinic effects on the myocardium. But in certain occasions, the prolonged reaction of acetylcholine can be seen. That is, in organophosphorus compound poisoning. The organophosphorus compound in the insecticide, it is usually used by our farmers to eradicate or to get rid of or control the insects. But the same organophosphorus compound is used by certain love failures. So, in order to save them from the ill or adverse effects of organophosphorus compounds, complete atropination of the patient is needed. Complete atropination. Complete atropination means how much atropine is needed that we can't say. Hundreds of ampules of atropine will be required to save the patient from the ill effects of organophosphorus poison. Of course, all other life-saving measures should be executed and 2 p.m. also. At the same time, lavating of the patient. The lavating of the patient is equally important. That is, the oral end of the patient and the aboral end of the patient should be lavated thoroughly. Then we can save the patient from the ill effects of organophosphorus poison. Note the point, take down. Next, the pharmacological management of constipation and obstipation among the medical students. It is a very common problem, you know, in our medical students, those who are residing in the hostels. Why it so? It is because they are faulty feeding. Every day, you know, they are fed with the dry chapatis. The steam cakes, you know, puttu. Then the salt mango tree, that is the upma. These are very commonly supplied in the hostels of medical students. And a majority of them are suffering from constipation and obstipation. But you need not worry about it, because in pharmacology, we have got plenty of drugs to tackle this problem. That is, I want to classify the students here, or medical students here. They should be categorized in 4 sections to manage the patient. As far as their constipation and obstipation is concerned, they should be divided into 4 categories. As we know that some of our medical students are so gentle to behave, so gentle by their character. So, for their constipation and obstipation, we must give gentle laxatives. Then only we will get an expected result. The next category of our students are actually highly irritant in nature. They are always highly irritant, you know. So, for that particular category, we must select irritant cathartics. The irritant cathartics will do goodness for these students. The next, you know, third category of our students are actually so simple. They are so simple to behave. So, we must give them suppositories. Then, of course, we will get a good result, no doubt about that. And the last group of students, you know, they are highly eminent by nature, by behavior, their intellectual activity, you know, they are co-eminent, you know. So, to get a positive result, we must use any matter. When you apply this any matter, you know, then only we will get a positive result. So, the selection of the student is a must. Result will be 100%, no doubt about it. Note the point and take down. The third topic, that is itching and irritability. Itching and irritability, you know, it's a very commonplace thing among the practicing doctors. Among the practicing doctors, you know, They are constantly being subjected to itching and irritability. It's actually a vicious cycle. Whenever they get itching, they are got irritated. Whenever they got irritated, that will produce itching also. So it is a vicious cycle. It seems to be very simple to manage, but some problem is there to manage. And we have got plenty of drugs in the pharmacology. That is, variety of antihistaminics of first generation, second generation, third generation, fourth generation, so on. Certain steroids are there. Of course, certain topical appliances are there to manage these things. But to get a relief for a long time, they should be given deveining agents, anti-health agents. Then only they will get a relief for a prolonged time. That is piperacillin citrate, albendazole, mebendazole, and pyrandyl carboate. In this context, I want to stress one particular drug, that is buffinium hydroxynaphtate. Buffinium hydroxynaphtate. It is otherwise called as alcohol. It is available as in 5-gram packets. It is available as in 5-gram packets. And the whole packet can be swallowed. All the worms, that is Ancylostoma duodenale, Enterobius vermiculitis, and the Nicator americana, all will be expelled from the GAD and they will get a relief for a long time. Not doubt about. Note the point and take down. The next topic I want to stress, it's a wonderful drug. It's a wonderful drug, It's not a wonderful drug. It's a wonderful drug. Why it is called as wonder drug? Why it is called wonder drug? Because this drug, it is all aspect is anti. That is phenothiazine groups of drugs or chlorpromazine or largactil. This is very effective drug, this phenothiazine group, that is chlorpromazine or largactil. This is wonderful in action because it is anticholinergic, it is anti-adrenergic, and it is anti-cholinergic. Yes, in all aspects it is anti. So it will play very, very wonderful effects in the patients, In this context, the effect of chlorpromazine can be well explained by an example. It can be explained by an example, And I actually presenting this example, from your point of view. This example, the effect of this chlorpromazine is I am here presenting from your point of view. That is, suppose you take chlorpromazine or largactil orally or either parenterally, and if you happen to see a very, very beautiful lady like Anandan, the dream girl of India, or another dream girl of Malayalam film industry, Miss Punnimeli, if you happen to see them after taking this drug, you won't mind them. You won't mind them definitely because of the effect of this chlorpromazine or largactil. Such a wonderful drug, No doubt about it. It's a wonderful drug. Your nature, your character, everything will be totally changed. That is why it is called as wonderful. You're the glamorous or beautiful actresses like Hema Malini or Punnimeli, If you happen to see them, you won't mind them. Such a wonder this drug can play. Got the point?
Yeah.
Take down. the last session. Not interfere to my class, you know.
Sorry, sir.
I am very particular.
Okay.
Yeah.
Silence, please.
So the 4 topics, you know, I want to tell you that is already finished. But next week, you will be having a exam or whatever on these topics. Next week. Very short notice, you know. Exam will be there the next week. And everybody should study the subject adequately and thoroughly. Because I am being a professor of pharmacology, I am very strict. So you must study the subject thoroughly and adequately and come for the exam. And I warn you that no homicide will be there in the examination. But if you don't study the subject adequately and thoroughly, there is a chance for suicide. So, you must study the subject, you know, thoroughly. On to the next one. Because I am insisting this point, you know, the pharmacology is a very specific subject. It is a very specific subject of modern medicine or modern medical science. Why? Pharmacology, you know, nobody else in the world can write or prescribe a drug of modern medicine except a doctor with basic degree of MBBS. Nobody else in the world can permit or they are not at all permitted to write the drugs of modern medicine, you know, or modern medical science. So it is so specific and prestigious, you know. Then all the products of the pharmacology are well researched. It is a time-tested medicine with specificity, predictability, sensitivity, and sensibility. What the point? Take note. And here I am. Want to inform you that I know that in the future or in the years to come, we will all become good or great doctors. No doubt about it. You all become good doctors or great doctors in the future. And you will host the flag of modern medicine, you know, and you will fight off. No doubt about it. Just like our great doctors of Calcutta Medical College, you know, Dr. G.K. Warrior, Dr. C.B.C. Warrior, Dr. C.K., Dr. N.S.V., Dr. M.T.S., Dr. Vijanaya, Dr. K.P.R., Dr. Rochai, Dr. Thomas Matthew, Dr. Sugadan, Dr. Kunyali, Dr. Ashokan Nambiar, Dr. Sarasnadam, Dr. Manadi, Dr. Saudabi, Dr. Kanagam, Dr. Badran, Dr. P.C. Rajagopal, Dr. Madam, Dr. Bakar, and Dr. Varma, and Dr. Hari. And of course, Dr. Harihan, you know, don't mislead me. I am married in the great doctors of our college, you know. Don't bluff. So, and Dr. Jairam Panikar, Dr. Guharaj, Dr. Aisha Guharaj. What wonderful names. This is really prestigious occasion, you know. So what are their names? This is, the list is so lengthy, I can't fill it up completely. But I can tell you in one point, you know, in the future, in the years to come, you all become doctors and great doctors, and your names also will be included in this list. It's a lengthy list, you know. Your names also will be included in this list. I'm sure that you will all become good or very great doctors in the future. No doubt about it. So I think this is high time to stop the classic. Because next week we have to prepare for the exam. Everybody should be thorough in the subject and come for the examination. So, I want to stop this class now itself. Okay? Okay? Okay.
Sir, can I ask a question, please, sir? Sorry, sir.